Pink eye can happen to anyone, but recently there appears to be a spike in cases in West Michigan. Emily Linnert spoke with a doctor about why.
Pink eye is going around, especially among the young ones. So why is that? Sarah Ronner, Chief Pediatric Nurse Practitioner at Corewell Health's Beaumont Hospital, joins us now. Thank you for joining us.
Thanks for having me.
So let's start with the basics. What is pink eye and how does one catch it?
So pink eye is actually a broad term for something we call conjunctivitis in the medical field. Conjunctivitis is an infection or inflammation in the lining of the eyelid and the inside of the eye itself. It comes in four different categories: viral, bacterial, allergic, and irritant is really the one that I term it, but it can be like a chemical conjunctivitis or something. It's going around right now are the viral and the bacterial versions. And they are contagious because kids touch everything. They touch something and leave some germs behind, and then someone else touches something and touches their eye or their mouth or their nose, and they transmit those little viruses and bacteria very easily amongst each other, which then in turn transmits it to the adults that they're around.
Yeah, I can see that happens at school a lot on desktops and other things that kids share. With school letting out, do you think possibly you'll see fewer cases?
Typically, we usually see a lot of pink eye, depending on viral or bacterial, from the months of November through April, May. We always have this little uptick when kids start swimming a little bit more. They're in pools where it kind of sits on the surface as well. And then through the summer months, it kind of goes away. We do see a ton of allergic conjunctivitis right now. So there is a lot of confusion out there on how do you differentiate between the four different types of conjunctivitis.
Yeah, and the doctor can tell you that, or a visit to a medical facility.
Yeah.
What is the danger with pink eye? It's an irritation. What do we need to watch out for when our kids come down with this?
So, speaking of just the viral pink eye or conjunctivitis, there really isn't necessarily a worry with it. The hard part is that for whatever reason, the public really doesn't want to get pink eye. A lot of people are like, oh my gosh, you have pink eye, don't touch me, don't do anything, because we don't want to transmit the germs. So with the viral version, it usually comes with runny nose, cough, cold, and then at the end of it actually comes out the pink eyes. Not as much yellow-green drainage from the eyes, more watery. Not so much risk with that by any means, but with the bacterial version, the infection, if it's not treated, it can progress into more of a cellulitis or a surrounding skin infection of the eye, and you can have vision loss, scarring, things like that.
So something not to ignore. Definitely seek treatment.
Yeah. If you wake up and you've got pink eyes and you haven't had a cold recently, or you didn't wear your contacts overnight, or you didn't, swim in the pool with your eyes open the night before and they're irritated and red, you can give it 24 hours. You can do cool compresses. You could try to take an antihistamine. You could do wetting drops. But if it's not getting better, you really should be seen.
Okay. And so the newest COVID strain may cause red, watery eyes. Is that why we're seeing more pink eye?
We thought for a little while, yes, but it's not atypical for this time of year. We always say in the beginning, especially with the allergic version, you'll see these eyes that come in, and parents are really terrified because the actual lining of the eye itself starts swelling, and it almost looks like the eye is coming out of the eye. It's, the lids can't close. That comes along with itchy, watery eyes. We see that a lot more, but we still see a lot of adenovirus and other viruses that will cause, pink eye as well. So it's not surprising that COVID would kind of do the same thing. I have to say, over here, we have not seen a ton of COVID lately.
That's good news. Sarah Ronner from Corewell Health Beaumont Hospital, thank you for joining us.